It looks like we are on.
Okay.
So, hello, I am Matthew Moore, and I am here with Carol McDonald, the program director of our brand new medical billing and coding program at MedQuest College.
Hello, everyone.
And we are excited today to discuss with you the ins and outs of the program, give you a brief overview of what to expect if you're interested in this field of work. And for anybody who's tuning in, be aware that at the end of our discussion today, there will be a question and answer session. So feel free to navigate to our Facebook page and go to the event for today, which is on our timeline. And feel free to ask and submit questions to that event, and we will hopefully get to those at the end.
I'd be more than happy to answer any questions that you have.
Yes, and this is brand new for us. So we hope that at MedQuest, this is going to be the first of many live info sessions regarding our programs. And I just want to say thank you to Carol.
Thank you for having me.
Yeah, no, this is
really neat.
It's exciting.
It is.
It's really exciting. So let's just start off with some basic information about you. What is your background as program director for medical billing and coding at MedQuest?
Well, I am new to the campus, and I have been a program director at a previous college, and I was actually a program director of Allied Health.
Okay.
And what Allied Health is, a program director for medical assisting and billing and coding. Just to kind of give you a background, I am a certified medical assistant, but I really am a certified billing and coding specialist.
Okay.
So what that does is that allows me to take the notes from the doctors, the nurses, the nurse practitioners, and I will take their notes on the diagnosis, their treatments, and I will translate those into numeric codes so I can send them over to insurance companies to get the money back into our office, so that way we could pay for the procedures. We could also help make sure our staff gets paid. Those are the things I really like to do.
So you have a lot of work experience that you see.
Yes.
I must be excited to bring that to MedQuest and share that with other students.
It is. I really like to, because one of the things I like to do is take my hands-on skills and my hands-on experience and relate that to the students in the classroom. Because it's hard for you to come in and talk to a teacher who doesn't know what they're talking about or who doesn't know how to explain it to someone. And when you actually have that real life experience where you can say, well, I know 36415 is an injection code, and we charge $25 for that. So I'm going to send that $25 charge over to the insurance company so that way we can get reimbursed for that. And that doesn't come out of your patient's pocket.
Right.
That's what we don't want to happen. That's why we need to make sure that we're detailed and we're organized, and we try to do this as accurate as possible.
Okay. Now, how would you explain to someone who doesn't know a lot about medical billing and coding the program that's offered here at MedQuest College?
Well, basically, the program is a 10-month diploma program, and what we teach you are core courses and non-core. Basically, what non-core courses are your anatomies and physiologies. That teaches you about the structure and the function of the body, the different types of organs that we have, the different types of systems that we have. And then the physiology of it teaches how they all work together. So, like for instance, you can't have a cardiovascular system without having a respiratory system, because your respiratory system helps reoxygenate the blood that goes through your heart, then translates it all and carries the nutrients out to the entire body. So your body depends on those two systems. And then you have what we call pathophysiology. Pathophysiology is the study of diseases and disorders. So you have to know how the body is structured. You have to know how it functions in order to be able to determine how the diseases and disorders affect the body. And then you'll have your core courses. Your core courses are like your better known as CPT, but it's also known as current procedural terminology. I referred to a code that was a 5-digit code earlier, the 36415. That's what we're talking about here.
Okay.
Your procedures all have a 5-digit code that specifies exactly what happened in the office or in a hospital or in a clinic.
Okay.
And then it has a charge associated to it. And then you have ICD-10, which is International Classification of Disease. Those codes there break it down to tell us what disease or disorder we're dealing with in particular. So like one that I'm trying to find ones that are funny. So I can put them up on the board and then the students get this.
Yeah, sure.
I found one for bitten cow.
Bitten cow?
Bitten cow. A cow bit a person.
I didn't know that that was a...
It is. There's silly ones out there.
I believe
There's
it,
one
though.
with the hair. There's a puppy dog on the website and his hair standing up. And it's called hyper... Oh, I cannot remember it. I'm so sorry.
No, but...
There are funny codes out there. One who are... there's a one for drunken.
Okay.
There's ones for people who are night blind. There's things for serious, for cancers, different types of cancers. But the one that I had was, and you'll see it on the board, but cow bitten, and then I put a tagline underneath it. There's a girl, she actually has her hand in the cow's mouth, and it says, "Who's the burger now?"
Okay, so it ranges from like your average ailment to some wacky, crazy things.
Correct, and there's codes in there that you wouldn't believe that are really codes.
Well, and it sounds like too that if you want to be successful in this program, you've really got to like learning different levels of data so that you can combine it all to be a really good medical coder.
The thing about it is education is fun.
Right.
You can make it fun. You can find the funny things about it. You can find, and even though this is a serious job, you still have to have some room for a little laughter and humor.
Right.
And there's always going to be laughter and humor in all education. It doesn't matter where.
Well, and it sounds like in this field too, with the amount of communication that takes place, your ability to communicate with other people, for instance, in the MedQuest classroom is really going to serve you well. And if you can add a little bit of levity to that conversation.
That's absolutely true, because some of the skills that you're going to have are like analytical skills.
Right.
Now, analytical skills mean you're going to have to be able to take what the doctor says in writing, and you're going to have to see if you understand what they're trying to tell you.
Right.
If you don't have to, if you can't understand that, then your communication skills are going to come in. You're going to have to go back to the doctor or the medical assistant or the nurse and say, "I'm sorry, but could you please explain this to me so I can better break this down, so I can better send this over for billing and insurance." You're going to have to be able to do that. You're also going to have to be detail organized.
Yeah.
Because you just can't say, "Oh, this is a code for that."
Right.
You can't do that. You have to be able to look through the textbooks that you're going to have, or your coding books, and you're going to have to be able to break down with detail what the diagnosis is.
Sure.
And then so that way you can send it over correctly to the insurance company for reimbursement.
And so, you mentioned that this program is extremely hands-on. And so we have this, these state-of-the-art facilities in Louisville and Lexington that students will be taking this program within. Would you say that hands-on experience really helps a student build confidence for when they enter the workforce?
Right, it does. Because one of the things is they're going to become technical savvy.
Right.
Now, granted, it's not computer programming, but they're going to be working a lot on the computers, and they're going to be doing what is known as EFT. EFT is electronic funds transfer, and they're going to be doing data transmission. So, like for instance, they could be sitting there with their laptop at their desk, inputting information in there, but they're also going to learn how to transmit this information over to another organization called a clearinghouse.
Okay.
And what the clearinghouse does is they look to make sure all the information on the form is correct. And if the information is correct, they'll go ahead and forward it on over to the insurance companies for reimbursement. But if it's not, it's going to come back to you for you to correct.
Okay. Now, we're talking about this program. How long does the program take? And from beginning to end, can you kind of walk us through what a student will experience in the medical billing and coding program at MedQuest?
Well, the program is a total of 10 months.
Okay.
And we will have 4 10-week sessions.
Okay.
And during those 10-week sessions, you will have either day or evening classes. It depends on your campus.
Okay.
And each class will run approximately 4 hours. Okay. Your class may meet once a week. Depending on which session you're in, like your first session, you're going to probably have anatomy and physiology, medical terminology, medical math. That'll probably be in your first session, but you'll have 4 classes per session until you get down to your 4th quarter. Now, your 4th quarter, you're going to have a certification review. Okay. Your certification review is preparing you to take your national certification exam. And the one that we offer here is the American Association for Professional Coders, which is we all better known to most of us as AAPC.
Sure. Okay.
You'll become a certified professional coder, or also known as a CPC. You'll become a certified professional coder. That is what a lot of employers are looking for. And then at the same time you're taking the certification review class, you're also going to be going out on your externship. Your externship is where you're going to be shadowing and performing certain duties out in a real world.
Okay.
So it could be in a hospital billing office, it could be in a clinic, it could be in a law office, it could be in a governmental agency or a service management company.
Okay.
There's many areas that you can do. And you're going to be able to take all these codes that you're learning. Granted, we don't expect you to know all the codes because the books, there's a lot of codes, there's a lot of disease and disorders, but you're going to take all this and learn how to put this into real life.
Okay.
And then once you're done with the externship, it's 160 hours.
Okay.
You'll come back, you'll take your certification exam, and you're done and you're ready to graduate.
So this is actually really exciting because this isn't just a surface level medical billing and coding program. We really dig deep into what medical billing and coders do, what they need to know, and that kind of incorporates these other medical classes that you talked about, like anatomy. So you're getting a really comprehensive education with this program.
Yes, and we're going to have instructors here that have at least 10 years or more experience.
Wow.
Yeah, and they're very versed in the information that they know. I have people that are working in offices. I have instructors that work in hospitals.
Okay.
And then I actually have some that oversee individuals who work from home. This is one of the nice things about this program. After you have enough experience, you can't just graduate and start to work from home. You can't do that. But after you have some experience underneath your belt and you have enough knowledge and skill set, you do have the capability of moving from the in-office to out to home.
Right. Well, and two, I mean, the way that technology is constantly shaping the healthcare field, the need for medical billing and for medical coders, people in this field, is just going to grow as technology continues to proliferate
It's not
in this
only
field
the
of work.
technology, though. Yes, technology has a lot to play with it, but the issue is, too, as our population continues to grow older, the need becomes greater. Not only does the need become greater, but we start to develop more diseases and disorders.
Right. Okay.
As time progresses, we start to find different things, and how it affects everybody.
Right.
So the need for billers and coders is expected to grow by 20 to 30% in 10 years.
Okay.
Yeah, so there's a great need for billers and coders now.
So right now is really one of the best times
to get
into this field with the way that it's growing. So that's exciting. I want to just let everyone know who's watching, who may have tuned in, that I'm here with Carol McDonald. We're having a discussion about medical billing and coding, and feel free to submit your questions to our Facebook event page. Now, I want to ask you, you mentioned that you have day and night classes. I want to ask you about the time commitment for students. So, you know, if you have a student that's maybe graduating high school and a student, you know, who has a family, how would you kind of explain to them the time commitment that this program requires?
Well, in comparison to what goes on with life, this is really a short time period of your life, 10 months. There are some students who go to school up to 4 years. The thing about it is yes, there is going to be a time commitment. Everybody's going to have a different time commitment. I expect everyone possibly 20 hours a week to come to class. And then depending on which class you have at least somewhere between 10 to 20 hour commitment outside classwork per class.
Sure.
So there is going to be a lot of time that you're going to have to apply toward your education and your studies in order for you to be successful. The more you apply yourself, the more successful you're going to be. But sometimes we know that there's going to be students that have issues that come up, and we're going to be more than happy to work with them. We know that emergencies happen. We know that life happens. We know that we have to be flexible, and we are flexible for our students.
Well, and you know, the nice thing about studying at MedQuest is that you do get small class sizes and you have faculty that themselves are career professionals, so they understand what to look for when a student needs help, and they are extremely willing to bring that kind of familial sense of care to that student to help them
That
succeed.
is definite. Because you have to stop and think. All these individuals who are teachers now were in your field.
Right.
They were in your shoes, going to school, taking the time out from their family and from work, so that way they could be successful and provide that better life for their family. And that's the whole goal of a lot of people coming to school, is they want to better themselves.
Right.
And what way to better yourself is get an education.
Exactly. I couldn't agree more. And so speaking of students, people who are driven to get that education to better their lives, how would you describe the ideal medical billing and coding student? What skills do they need to have?
Well, you have to have analytical skills for one. You have to be, you have to have really good social skills.
Okay.
Now, one of the things is with the social skills, you have to be able to communicate. And hopefully that's some of the things that we're going to teach you here.
Sure.
Not only are we going to teach you analytical skills, social skills, but hopefully we can help you with your detail organization. Some people always get a little scattered when they get too much on their plate. We understand that.
Right.
But hopefully we can help guide you to the correct ways to do that. We're also going to teach you some professional skills.
Okay.
Everybody thinks that the professionalism is just given. Not necessarily,
Right.
because it's going to depend on where you work, what type of professional skills. Professionalism isn't only the way you talk or the way you do paperwork. It's the way you present yourself to other individuals. It's the way you interview. It's the way you're able to communicate that information to others. The other thing about, let's see, analytical skills, social skills, detail organization, technical skills.
Yes, of course, because you're working with computers in this program.
Technical skills, right. You're going to be working a lot with computers. So you're going to have to know how to be able to input information in your system and how to take that information and output it to the correct organizations that's going to be able to process your information for the insurance companies.
Right.
So those are some of your main skills. Responsibility,
Right, of course.
punctuality. Those are skills that are quite very important. If you're late to class, that's just a telltale sign that you might be late to work also. And what would happen if you were late to work?
Right.
Your employers aren't going to like that. And the issue with this is it's a medical field.
Right.
What if your ability not to come to class or come to school or come to work on time affected how your provider performed?
Right.
So that could be your doctor.
Right. So it sounds like, you know, in terms of preparing students to really succeed in their career, it's not just about learning how to bill and code and learning the ins and outs of that system. It's learning how to be a fully functioning employee once
That
you
is correct.
graduate.
Yeah, it's because it's teamwork.
Right.
We all work together as a team for the same common goal. Here at MedQuest, we're like one big family. We all work together to ensure the success of all of our students, whether it's medical billing and coding, medical assisting, or the other programs that we have here. We all work together for the same goal, and it's our students. We're student focused here. We really are. We have a lot of people here who really enjoy our students.
Yeah, I can definitely attest to that. You know, the level of commitment that our faculty at MedQuest
We
have
really do.
towards nurturing a student's journey in their program is just, it's exceptional.
It is.
And I'm extremely proud to work here.
I am too.
Yeah.
I really am.
So it sounds like, right, so if you're a tech savvy kind of person, if you enjoy the medical field, learning about that kind of stuff, if you want a job that demands a certain amount of commitment and responsibility, if you want to become that person, that professional, then definitely don't hesitate to give MedQuest a call and talk to admissions.
Here's the other thing. If you're one of those type of individuals who wants to work in the medical field, but you don't want to have patient interaction, this is the perfect job for you, because you can still work in hospital centers, clinics, law offices, government agencies, service management organizations. You could still have that ability to be involved in the medical scene, but be a little bit behind the scene more than having to deal face to face with the patients. You could do that.
Okay. Now, what kind of places can medical billing and coding students upon graduation expect to, find job openings? Where do they work?
Hospital billing offices, clinic offices, insurance agencies. Like when I say insurance agencies, I'm talking medical insurance companies like Anthem and WellPoint and things like that.
Okay, big players.
Kentucky One,
Right.
possibly, yes. You could do that. You could actually work at information technology companies that specialize in billing and coding. You could work for billing offices. There's offices that are collection agencies for even that. And you could also work in educational institutions.
Right.
If you have enough background information and you know that you're proficient with what you know, and you have that real world life experience working out in the field, we could bring you in as an instructor. There's a possibility. Law firms is another one that you could do. Law firms have a lot of medical malpractice.
Right.
So when you're doing medical malpractice, there's these codes that are coming across these lawyers' desks. They don't know what they are. That's why they need billers and coders there to tell, well, what is this?
What is this cow bite? Why is someone getting bit by a cow?
Yeah. Government agencies.
Right.
And the government agencies are like Medicare and Medicaid.
Right.
So they're going to have to know how to do billing for Medicare and Medicaid also.
Yeah.
Yeah.
And so, and two, another, so you're teaching students in a real classroom environment.
Right.
Not only how to do the work, but how to become a professional. And it's like you're really preparing students to do so much when it comes to upon graduation, so that they're ready to not only do the work, but they're ready to work for a multitude of agencies, right?
That's right.
Yeah.
They really are. They're eligible to work for a lot of different agencies. It's what they want to do.
Yeah.
Now, what we'll do is I'll help place them in an externship. And a lot of times, if the students are really good and they like where they're working at and the externship is looking for employees, it is quite possible that they could walk away from their externship with a job offer.
And that's exciting because at MedQuest, it's a mandatory part of the program that a student participates in this externship before graduation to get that real world experience.
That is true. That is true. And one of the things about it is when you find a place that you like to be at and you fit in and it's your externship, it makes it even more rewarding for you because you know that you've taken everything that you've learned from MedQuest that we had to offer you in your education and you were successful.
Right.
You're going to be successful when you leave here. There's no ifs, ands, or buts.
Yeah.
It's just applying yourself and us applying ourselves to help you become the person that you want to be with the education that you have.
So, in a nutshell, if you want to be that successful professional, if you have an interest in healthcare, if you are comfortable using computers, and you are willing to learn, then this really is.
This is for you.
This is the program for you.
This is for you, definitely.
And this program is being offered right at both campuses.
Both campuses, Lexington and Louisville campus. And we are starting enrollment, and our first classes are May 21st.
Oh, May 21st. So if you're out there, if you're listening or watching, don't hesitate to reach out to us on Facebook or call our admissions directly during business hours, and we will be happy to give you all the information you need.
Is our contact information for them available?
It is. So
Okay.
I mean, it's on our, it's on our Facebook page. We have our phone numbers there. And if during business hours, if you want to go to our website, even you can get more information there. And we have admissions agents ready to chat with you on the website to answer any questions you have about this program. That's pretty exciting.
It is. It's very exciting. We are growing, and the technology that we have here is great.
And it's just, and that ties directly into what students will be utilizing while they're in this program.
Because they'll be using electronic health records, so that starts their journey on the technical side of everything.
Okay. Now let me ask you. You mentioned about the faculty in this program. Who will be teaching this program? What kind of faculty will be helping students through their journey?
Well, they're all going to be certified professional coders. And they are certified through the American Association for Professional Coders. And they all come, there are some that are coming from different hospital organizations around the Kentucky area in Louisville and Lexington. Some of them are coming from private clinics, but they are going to be working with us.
Okay.
Yes.
All right.
I don't want to reveal who they are just yet.
Yeah.
So, but that's their experience. I have some that have 20 to 30 years experience.
Okay.
And I have some that have 10 years.
Okay, so
Yeah.
really though, it's
a variety of experience.
it's a variety of experience from different fields, I imagine.
Yes.
That will help a student really get a well-rounded view of the field.
Yeah, we have some who are specialized, which they could, billers and coders can do that
Sure.
if they like a particular area. If they want to work in, like, say for instance, OBGYN, obstetrics and gynecology. We have one that is specialized in that area. That's all she does.
Okay.
Then we have people who are just billers, and we have people who are just coders.
Okay.
That's the nice thing about our program here, is that we train you for both jobs. This is a 2-in-1 job. You can either be a professional biller and coder, you can be a professional biller, or you can be a professional coder.
Okay.
It's up to you. It's 2 jobs.
Yeah.
Yeah.
So there's a freedom of choice here for
Right.
students.
Right.
And it sounds like, right, they'll be working with people that can help them understand how to make that choice.
That's exactly right. And they're going to help them be successful. And when they don't understand, our instructors are willing to go above and beyond until you understand the concept that they're trying to present to you in the classroom. I will even be one of your instructors.
Okay, all right.
Yeah.
So if you're enjoying what you're hearing so far and you want to work with Carol, by all means, look into
I
signing
like
up
to
and
have
enrolling.
fun in class.
Well, speaking of that, just as a closing question, what do you love about MedQuest? What do you think students are going to love about MedQuest when they enroll?
What I see here is that it's a big family here. And everyone here goes above and beyond to help each other out. It doesn't matter. We have fun here, whether it's in the classroom or with each other. There's a lot of camaraderie here, communication, open communication,
Okay.
and new advances.
Yes.
Thanks to Mr. Matt here. This is our first live webcast.
Yeah.
So we're willing to go above and beyond and venture into areas that no one has gone to yet.
Yeah, and I think that we're constantly trying to look at what we're doing and ask ourselves, how can we make this better? How can we make the student experience even more powerful?
It's not only what we think, it's what our students think.
Right.
We ask our students, well, what do you think that we can do to make it better? And we take and we put that into, how do you want to say this? We take their ideas and we incorporate it into our mission. Yes.
And our goal really is to just educate students so that they feel confident and comfortable in a professional career.
In a professional career, at the same time we're having fun.
Right, of course.
Yeah, well, like this week. What are we doing this week?
It is Student Appreciation Week at MedQuest, so we've got a lip sync battle taking place in just a few minutes,
Yes.
actually.
Yes.
So if you're a student out there, if you're watching, if you can get down here, we'll have it today, we'll have it tomorrow on Wednesday, but that's just an example.
Come take a tour of our campus over today or tomorrow and you'll get to see this.
That's true.
That's true.
Unfortunately, it looks like we have run out of time. We've spent a good amount of time, almost a half hour, talking about this program.
Awesome.
It is awesome.
That's awesome.
So, in closing, if you have any questions, if you're interested in the program, as I mentioned before, reach out to us, visit our website, give us a phone call, and we will be happy to connect you with admissions and get you the answers you're looking for.
You can even call and ask to speak to me. I'd be more than happy to talk to you.
You get to the star of the show. You can talk directly to the star, Carol.
No, the star's over here.
Maybe we can both share it today.
Okay, we'll share it today.
I want to thank you again for taking the time.
Thank you for doing this.
Yeah, this is going to be good, and we hope to see some students interested. And
I'd look forward to hearing from you soon.
yeah, thank you all so much.
Thank you. Have a good day.